Hi, my name is Stephanie Curran, and the part of the presentation that I contributed is the third stage of the patient's presentation, the nursing interventions, and some critical thinking questions. So this patient has had a right femoral heart cath. Currently, he is resting in bed without any complaints of having chest pain. He is awake, alert, oriented ×4, where his vital signs are stable. There is a closure device over the right groin area to apply pressure so there's no bleeding going on at this site. Some nursing interventions for this patient who is a post-heart cath is to maintain that the patient lays flat for 4 hours and to keep the right leg straight. You also want to monitor his vitals every 15 minutes for 1 hour, every 30 minutes for 2 hours, and then hourly after that. You want to assess the cath site for any bleeding or signs of hematoma formation. You also want to check the pulses in the feet. Make sure that there is proper blood flow, that the feet aren't going cold, that the pulses are present, and that the color maintains normal. Also, once the pressure device has been removed, you want to apply a pressure dressing, which is basically just a gauze and a Tegaderm over the site. Some critical thinking questions. Why is it important to give 324 milligrams of aspirin to patients who present with chest pain? What are the risk factors that this patient presents with for a myocardial infarction? Why is oxygen given to patients who are having an MI? And why does the patient need to lie flat for several hours after a femoral heart cath? So the answers are, it is important to give aspirin because it prevents platelet activation, and you don't want any new blood clots to form if there's already one formed in the heart. So this will prevent any new blood clotting forming. Some of the risk factors that our patient has is he is male, he smokes, he has a family history of not only heart disease, but his father has had a heart attack. He's diabetic, he has high blood pressure, and hyperlipidemia. Why is it important that MI patients receive oxygen? Well, during an MI, it impairs the circular function of the heart. Oxygen extraction by the heart and other tissues may be diminished. Supplemental oxygen should be given during an MI for 2 to 6 hours. You really don't want to oxygenate any longer than that. And the patient is told to lay flat without movement of that leg to ensure that the artery heals and there's no significant blood bleeding in that site. You can have retroperitoneal bleed, you can bleed into the thigh, which is something you completely want to avoid. So, thank you for letting me present.